And so here we are again at another very, very busy time for the NHS, and there's a couple of messages that I'd like to give. Firstly, I'd like to thank all the staff who are so very busy in hospitals and in primary care and general practices, who are working so very hard at the moment. Many people worked hard over Christmas and the New Year and haven't had a break, so thanks so much for all your hard work. Now, how can everybody thank them? Especially, I think really there's a couple of things you can do. One is to think very hard about whether you need to go to A&E. We'd like you to think twice, 3 times, even 4 times about whether really your illness is such that you do need to go to a hospital. I'm sure we'd all agree that it's very important that hospital A&E departments are allowed to get on and treat the patients who most need hospital care. And so my plea is not to go to hospital unless you really do have a serious medical problem or if you've sustained a really nasty injury. Having said that, I'm also a little reluctant to say, well, go and see your GP, because general practice, or primary care as we call it, is also incredibly busy at the moment. Many practices reporting that they're quite overwhelmed with the number of people who are asking to be seen on each day of the week. And so please do think hard about whether you need care from hospitals, whether you need care from primary care, or whether there are other places you can go to obtain good medical advice. And the obvious things to say are that you can get excellent advice from your local pharmacy. No doubt they're busy too, but if you're willing just to be patient, I'm sure that they'll be willing to give you advice and maybe sell you some over-the-counter medicines. It's also possible to look on the NHS Choices website, which contains a wealth of information about how to treat common minor medical illnesses. So it is busy. Please allow the NHS to devote itself to the patients who most need our care, and please do take responsibility for looking after your own health whenever possible.